Hey everyone, Dr. Caleb Sterling here. Today, I want to talk to you about something that most people overlook when it comes to diabetes: your feet. Now, I know that might sound odd, but stick with me because what happens in your feet can actually tell you an incredible amount about your blood sugar levels and your overall metabolic health. In fact, your feet are like an early warning system that's constantly sending signals about what's happening inside your body. Over my years of practice, I've noticed that so many people catch diabetes too late because they're not paying attention to these foot-related warning signs. The thing is, diabetes doesn't just suddenly show up out of nowhere. It gives us clues, it sends us signals, and unfortunately, a lot of those signals show up first in our feet. Today I'm going to walk you through 9 specific warning signs that your feet might be trying to tell you that diabetes is developing or is already present. Some of these you might recognize, some might surprise you, but regardless, if you notice any of these changes in your feet, it's really important that you see a healthcare provider for proper evaluation and testing. Let's get started. Sign number 1, tingling or numbness in your toes and feet. One of the earliest and most common warning signs I see is tingling. Now, when I say tingling, I'm talking about that pins and needles sensation that you might feel in your feet, especially at the end of the day or during the night. Some people describe it as a burning sensation. Some feel like their feet are falling asleep even when they haven't been in a position that would normally cause that. Here's what's happening. When blood sugar levels stay elevated over a long period of time, it damages the small blood vessels and nerves in your feet. This is called peripheral neuropathy, and it's one of the most common complications of diabetes. The damage happens gradually, so you might not notice it immediately, but as it progresses, this tingling becomes more persistent and more annoying. The reason you feel it more at night is really interesting. When you're lying down and relaxing, you become more aware of subtle sensations in your body. Your feet are getting less circulation when they're not moving, so the nerve damage becomes more noticeable. If you're experiencing regular tingling in your feet that's not related to pressure or position, that's something worth getting checked out. Don't wait for it to get worse. Sign number 2, numbness that affects your balance. Now this one is particularly important because it relates to safety. When the nerves in your feet start to degenerate from high blood sugar, you don't just lose sensation from pain, you lose proprioception, which is your body's ability to know where your feet are in space. This is your balance and coordination system. I've had patients come in and tell me they've suddenly become clumsy. They're tripping over things they wouldn't normally trip over, they're knocking things over with their feet, or they're noticing that walking in the dark is much harder than it used to be because they can't feel their feet properly. This is actually dangerous because it increases your risk of falling. And for people with diabetes, a small fall that might seem minor to someone else can turn into something much more serious because diabetes also impairs wound healing. So that small cut from a fall can become an ulcer or an infection very quickly. If you're noticing that your balance has gotten worse or that you're more prone to tripping, especially if this has happened gradually over time, that's worth investigating with a healthcare provider. Sign number 3, swollen feet and ankles. Swelling in your feet and ankles is another warning sign that something's not quite right with your blood sugar regulation. Now, some swelling is normal if you've been standing all day or if you're in hot weather, but what I'm talking about here is persistent swelling that you notice more and more over time. When you have high blood sugar, it affects your kidney's ability to regulate fluid balance in your body. It also causes inflammation throughout your circulatory system. This combination means that fluid starts to accumulate in your tissues, particularly in your feet and ankles because of gravity. What's really important to notice is whether the swelling is consistent. Does it come back every day? Does it get worse as the day goes on? Do your socks leave deep marks in your skin? If you press on the swollen area with your finger, does the impression stay there for several seconds before bouncing back? This is called pitting edema, and it's definitely something that needs to be evaluated. It can be a sign not just of diabetes, but of complications related to diabetes affecting your kidneys or your heart. Sign number 4, changes in skin color and texture. Take a close look at your feet right now. Do they look the same color as they did a year ago, 2 years ago? Sometimes, the first thing I notice when I examine a patient's feet is a change in color. It might be a darkening of the skin, or it might be an unusual redness, or even a purplish hue. What's happening here is that high blood sugar damages the small blood vessels in your skin. This reduces blood flow to your feet, which changes their color. Some areas might get darker due to increased pigmentation from inflammation, while other areas might become pale or shiny. Another thing to look for is changes in texture. Does your skin feel dry and papery? Are your feet losing their normal hair growth? Is the skin getting thinner? These are all signs that circulation is being compromised. I also want you to look between your toes and on the bottom of your feet. Sometimes the skin becomes shiny or starts to develop unusual patterns. This is one of those subtle changes that's easy to miss unless you're really paying attention to your feet. Sign number 5, slow healing cuts or sores. Here's something I really want to emphasize because this can escalate quickly. If you've noticed that cuts or scrapes on your feet are taking much longer to heal than they used to, that's a significant red flag. In a healthy person without diabetes, a small cut on your foot should heal in a week or two. With elevated blood sugar, that same cut might take weeks or even months. Sometimes what starts as a small sore can turn into an ulcer that just won't heal. Why does this happen? Because high blood sugar impairs your immune system's ability to fight infection and activate the healing process. It also reduces blood flow to your feet, which means the oxygen and nutrients your skin needs to repair itself aren't getting there efficiently. This is genuinely serious because diabetic foot ulcers are one of the leading causes of amputation in people with uncontrolled diabetes. I'm not saying that to scare you. I'm saying it to emphasize how important it is to pay attention to this sign. If you have a cut or sore on your foot that hasn't healed in 2 weeks, or if you notice pus, increasing redness, warmth, or if you suddenly develop a dark scab that looks like tissue death, you need to see a healthcare provider right away. Don't wait. Don't assume it will eventually heal on its own. Sign number 6, frequent foot cramps and pain. Do your feet cramp up, especially at night? Does the pain sometimes wake you up? Or maybe you're noticing sharp pains in your feet that come and go throughout the day without any obvious reason. Diabetic neuropathy creates this really unique pain pattern that my patients describe in different ways. Some say it feels like burning, some say it's like walking on glass, some describe it as stabbing or shooting pains. The thing they all have in common is that it often gets worse at night. The reason for the nighttime pain comes back to that nerve damage we talked about earlier. When you're resting at night and your nervous system is trying to shift into relaxation mode, the damaged nerves start firing off pain signals more intensely. It's like they're misfiring because they've been damaged. Muscle cramps in your feet and calves are also common because the nerve damage interferes with the communication between your nerves and muscles. Your muscles don't get the proper signals they need, so they contract involuntarily and painfully. If you're waking up with foot pain, or if daily activities are becoming painful because of foot discomfort, this is something that absolutely needs to be investigated. Sign number 7, changes in temperature sensation. This one's a bit more subtle, but it's worth paying attention to. Start noticing how your feet feel when you put them in warm or cold water. In healthy feet, you can normally feel temperature changes pretty clearly. But as neuropathy develops from diabetes, you lose that sensitivity. What I mean is, you might notice that you can't really tell if water is hot or cold anymore. Or you might only feel extreme temperatures. You might stick your foot in a bathtub and not realize the water is too hot until you notice your skin is getting red. This is genuinely dangerous because it increases the risk of burns. I've had patients who've unknowingly soaked their feet in scalding water and caused serious burns because they couldn't feel the temperature properly. Another thing related to this is that your feet might feel cold all the time, even in warm weather. Or the opposite, they might feel hot and uncomfortable when everyone around you is comfortable. This is because the nerves that regulate blood flow and temperature sensation aren't working properly. If you're having trouble with temperature sensation in your feet, be extra careful about checking water temperature with your hands first. And if you're noticing consistent temperature problems, get that checked out. Sign number 8, fungal infections that won't go away. Here's something that people often don't connect to diabetes: recurring or persistent fungal infections. Maybe you've had athlete's foot or toenail fungus and you've treated it, but it keeps coming back. Or maybe you treat it and it goes away for a while, but then it shows up again a few months later. High blood sugar creates the perfect environment for fungal infections to thrive. Why? Because fungi love glucose-rich environments. They feed on it. Additionally, elevated blood sugar impairs your immune system's ability to fight off fungal infections, so your body can't fight back as effectively as it normally would. Toenail fungus is particularly common in people with diabetes. You might notice that your toenails become thick, discolored, crumbly, or deformed. They might turn yellow, brown, or white, and they might become painful or develop an odor. Athlete's foot in the diabetes population is also common, and it can spread to other areas of the foot, creating larger areas of broken skin where secondary bacterial infections can develop. If you have a fungal infection that's recurring despite treatment, or if you're getting fungal infections more frequently than you used to, that's definitely worth discussing with a healthcare provider as part of an overall diabetes screening. Sign number 9, blisters or calluses in unusual places. The last warning sign I want to talk about is the development of blisters or calluses in places where you don't normally get them, or getting them much more frequently than you used to. When you have diabetes and neuropathy, you lose the protective sensation in your feet. This means that areas of friction or pressure don't hurt the way they normally would. So your feet keep getting irritated in the same spots, but you're not feeling it and you're not making the adjustment to protect that area. This leads to blisters developing. What happens next is really important to understand. These blisters can become open sores. Open sores can become infected, and in someone with diabetes, that infection can spread quickly because their immune system is compromised and the blood flow to the feet is already reduced. I also see people with diabetes developing calluses in really unusual places that don't normally bear weight or friction. This happens because as sensation decreases, pressure and friction patterns change, and the body responds by building up protective calluses in unexpected areas. If you're developing blisters, open sores, or calluses that don't have an obvious cause, or if they're appearing in unusual locations, definitely have a healthcare provider take a look. What you should do right now. Okay, so you've listened to these 9 warning signs, and maybe you're recognizing one or more of them in your own feet. What should you do? First, don't panic. Recognizing these signs early is actually the best thing you can do. Early detection of diabetes or prediabetes means you have the most opportunity to make changes and prevent serious complications. Here's what I recommend. Start by scheduling an appointment with your healthcare provider. During that visit, be honest about what you've been noticing in your feet. Tell them about any tingling, numbness, swelling, color changes, slow healing, pain, temperature changes, infections, or unusual blisters or calluses. Be specific about when you notice these things and how long they've been happening. Your healthcare provider will likely want to do some simple tests. They might do a fasting blood sugar test, a hemoglobin A1C test, which measures your average blood sugar over the past 3 months, or a glucose tolerance test. These tests will tell you whether you have diabetes, prediabetes, or healthy blood sugar levels. They'll also probably do a physical exam of your feet, and they might use a monofilament test or a tuning fork test to check your sensation. Beyond the medical evaluation, I want you to start paying closer attention to your feet every single day. This is not to make you anxious. This is to help you catch any changes early. Every morning and evening, take a look at your feet. Check for any sores, blisters, changes in color, swelling, or anything that looks different than it did the day before. If you do get diagnosed with diabetes or prediabetes, the good news is that there's a lot you can do about it. Blood sugar management through lifestyle changes can genuinely reverse prediabetes and significantly improve diabetes if caught early enough. This means eating in a way that keeps your blood sugar stable. Focus on whole foods, adequate protein, healthy fats, and non-starchy vegetables. Be mindful of refined carbohydrates and sugary foods because these spike your blood sugar quickly and dramatically. Movement is also incredibly important. Regular physical activity helps your cells use glucose more efficiently and improves your body's overall insulin sensitivity. Sleep matters too. When you're sleep deprived, your body becomes more insulin resistant, you're craving more sugar and carbohydrates, and your blood sugar control gets worse. So prioritize good sleep. Stress management is another key piece because chronic stress elevates cortisol, which raises blood sugar levels. Find ways to manage stress that work for you, whether that's meditation, time in nature, exercise, or creative pursuits. And if you do have feet that are showing signs of diabetes complications, take special care of them. Wash them daily with warm, not hot water. Dry them thoroughly, especially between the toes. Moisturize them, but avoid putting lotion between the toes. Keep your toenails trimmed straight across. And don't go barefoot, always wear protective footwear. Your feet are incredibly important. They carry you through your life and they're constantly communicating with you about your health. The 9 signs we've talked about today, tingling, numbness, swelling, color changes, slow healing, pain, temperature sensitivity, infections, and unusual blisters or calluses, these are all signs worth taking seriously. If you recognize any of these in your own feet, I want you to commit right now to scheduling a healthcare appointment. Don't put it off. Don't assume it will go away on its own. Early intervention makes a tremendous difference in preventing serious complications. And if you don't have any of these warning signs, that's wonderful. The best thing you can do is continue to take good care of your metabolic health through healthy eating, regular movement, good sleep, and stress management. Before we wrap up, I need to include an important medical disclaimer. This video is for educational purposes only and should not be considered medical advice. If you're experiencing any of the symptoms discussed here, or if you have concerns about your health, please consult with a qualified healthcare professional for proper evaluation, diagnosis, and treatment recommendations. Thank you so much for watching. I really appreciate you taking the time to learn about this important health topic. If this video was helpful, please like, comment, and subscribe for more health education content. And if you have questions about foot health, diabetes, or anything else related to your well-being, feel free to leave them in the comments below. Take care of your feet, take care of your blood sugar, and take care of yourself. I'll see you in the next video.